Hi guys, it's Dr. Nick again. Now we're just going to move on to the second part, as we talked in the first part about choosing our symptoms based on the different parts in the body in order to come to this stage where we will now choose the specific organs that we want to test or scan in order to get information out for future analysis. So first thing we do is we try to expand this menu because there's many we can choose from overall. However, what we really want to do is we want to be able to be as specific as possible in terms of our symptoms and in terms of our hypothesis of where things might be going. We always start when we do our top base catalog groups, which look at the overall body in a general sense, and then once we have those, we can go into specifics. So in this case, say with this individual, they have some gastrointestinal complaints, so we can check the small intestine. We can check even the tissues of the gastric or the stomach, and we can even check the esophagus too. And then as we're going down, we can again check the large intestine, and keep going down and check even the, as we can see here, we know the gallbladder post resection, so we can check that just because in this case we showcase that this person had their gallbladder removed. So that could give us some information in terms of what's going on without the gallbladder at this point. But we'll check the liver, and then we can keep going down, and whatever makes sense in terms of this person, their condition, we can check. But we'll check a general set of organs, and then we can go into more specific. So we can check, say, the lungs a little bit, the kidneys, in terms of what's going on. If we feel there's any problems with urination, we can check the urethra, we can check the prostate, and the male organs, of course. That's a priority. And if there's any problems in the heart, we would be able to look into specifics there in terms of vessels. Same thing, head and neck veins. So maybe because they get a little bit dizzy, it's a little bit their memory is a little bit slower. We can also check the veins in that area and the arteries in that area, and we can check also the physical arterial vessel walls, and also the walls of the veins too, which will give us some information. And then we go back and we check the lymphatic system, the tissues there. We can even check the thymus gland, and if maybe they're constipated, they're sluggish, we can also check here, as you can see, the physical thyroid, and can go even more specific in terms of the tissues. So we'll check the general thyroid and the tissues, and then the adrenals if they're fatigued overall, say. We always want to check the hypothalamus nucleus, different parts of the brain here in terms of different neuroendocrine functions. We can check the spinal nerves overall if there's any pain, and then we can keep going down and seeing blood-brain vessels. So let's maybe check those areas just for that fact. And then nerves in the back, and maybe brain tunicates. And then if we had any problems in the ears with ringing things, we can physically check the auditory organs too there. And again, shoulders, so we were saying maybe the left shoulder is painful, so we can check that physical joint. And then also we can check the articular surface of that and the bony tissues there, so we can see if there's any pathology down to the bone. And then we keep going down, seeing what else is there. And then we want to check connective tissue and then our chromosomes. So in this case too, just to make it easier, you can put this into kind of folders and make it easier, or you can put it as physical pictures, as we'll show here. Or it doesn't show it here. And there it is as pictures. So it makes more sense maybe if you're an operator or to a provider, but also for the patients to see what's going on. So once we have collected or clicked on all that we want to kind of test, and we can always go back and test in the future, what we would do, we would push this button right here, running diagnostics, and then this would run while the patient has their headphones on. They have in both hands the rod and the flat metal plate. That's the discharge area, and then of course we have something that looks similar to like a laser in a sense that gets focused on the kind of thymus area just in the front of the chest in order to create a more accurate result when the system is going through and assessing the actual patient. So I'm going to click run diagnostics, but nobody's hooked up, so it's going to show an error message. But in the next video, I'm going to show a little bit more in depth of what the scan looks like. So as you can see, put the CVS sensors on head, continue the survey. So next video, I'm going to showcase what a scan looks like. So hopefully that was helpful, and stay tuned so we can keep learning more together.